All right, well, welcome. The presentation is Understanding Your Child's Hearing Loss. My name is Jessica Evanstead. I'm an audiologist and I work at the Elks Hearing and Balance Center. All right, so what is the agenda for the presentation? There's quite a bit of information that we're going to go over. These are some of the main highlights that we're going to hit in this presentation. The first one is how do we hear? We're going to go over how the human ear processes sound. We're also going to look at different causes of hearing loss. What hearing loss is, there are different types of hearing loss. There's different degrees or how much hearing loss there's present, and also different configurations or different shapes of what the hearing loss is like. We're also going to go over what some of the effects of hearing loss are on development, different hearing tests that we're going to use on children at certain ages, what tests do we need to do to get information from them, and then we'll also go over how to read an audiogram. So how do we hear? The human ear can be separated into three different parts. We have the outer ear. This is the part that we see on the side of our head, and the ear canal, where everything you can stick your finger into, or you hear nothing smaller than your elbow goes in. The second part is also known as the middle ear. This is where the eardrum and those three small bones are located. You may have learned them as the hammer, the anvil, and the stirrup. They have slightly different medical names for that. And then the third part of the ear is known as the inner ear. The other name you may have heard it by is the cochlea. So all three parts of the ear needs to work together in order to have normal hearing. If there's one part or two parts that are not working correctly, then that's what happens with hearing loss. That's how that develops. Okay, so first we have the external ear. This is where our ear collects sound in our environment and starts to funnel it down into our ear canal. The second part, is the eardrum. When the sound vibrations hit the eardrum, it transfers it from those sound waves into vibratory motion. So the drum kind of goes back and forth, just like if you were to hit a snare drum or a bass drum, it causes a vibration. The third part is the middle ear. What those little bones do is they take the vibrations from the eardrum and they amplify that sound even more, as we're channeling that energy into our head, and so we need to make sure it's a louder signal for us. And then once it does that, it transfers the sound down to the inner ear, or the cochlea. Inside the inner ear there's fluid, and in there's a bunch of thousands of hair cells, and so those bones move the fluid inside the inner ear, and all of those little hair cells move from that wave motion that the fluid creates. Once those hair cells move, they send a signal to our auditory nerve, which then fires and goes up to the brain saying, you heard something. So as you're listening to me, all of this is simultaneously happening. It's going from the outer ear down to the eardrum, moving those bones, moving the fluid in the inner ear, and firing on your auditory nerve. So here is a small video clip I have of how we hear. We'll just pull that up. Okay.
Sounds are formed anytime an object creates vibrations. These vibrations travel through the air, just as ripples travel across water. Hearing begins when the vibrations reach the outer ear, which functions as a funnel, collecting these sound vibrations and directing them toward the eardrum. As sound vibrations are picked up by the eardrum, they are transferred to a series of three tiny bones in the middle ear. These bones further amplify the vibrations of the eardrum and transfer them to a sensory organ in the inner ear called the cochlea. The inside of the cochlea is filled with fluid and lined with tens of thousands of tiny hair cells. As vibrations pass through the fluid, it causes movement of these hair cells. This motion causes electrical signals to be sent along a specialized nerve, which are then processed into the sounds we hear.
All right. Okay, so these are some interesting tidbits about the ear and the hearing. The first one we have is the smallest bones in the body are actually those three little bones in our middle ear. The cochlea, or the inner ear, is the size of a pea. So a very, very small organ of hearing that we have. The characters of Chewbacca and the Incredible Hulk were actually performed by actors who have hearing loss. And Deidre Downs, who was Miss America 2005, she has hearing loss as well. She is actually working on becoming a pediatrician. And then another tidbit is our hearing range is from 20 hertz to 20,000 hertz. So there's a very, very wide range of pitches we can hear. However, we mostly use 500 to 6,000 hertz for communicating with speech and other words. And then lastly here, babies will actually recognize mom's voice because they can hear it in utero or while they're in the womb. All right, so what is hearing loss? Hearing loss, as defined by the CDC, it can happen when any part of the ear, whether it's the outer ear, the middle ear, and or the inner ear, is not working in the usual way. So kind of like we talked about earlier, if something's not functioning or working the way it's supposed to, some type of hearing loss is developing. Another definition is a reduction in the ability to hear soft sounds. Soft sounds include whispering, hearing the leaves rustle outside, a clock ticking in the background, different things like that. All sounds we're kind of used to hearing in our everyday life, but don't really tend to think about. All right, so some facts about childhood hearing loss. For every 1,000 children born, there's approximately 3 to 6 children that will have some form of hearing loss. 98% of newborns nationwide in the United States are now being screened for hearing loss at birth, which is fantastic. 95% of babies born with hearing loss are born to parents with normal hearing. So a lot of times that diagnosis can be very shocking and seem very surreal to a lot of parents. Hearing loss is invisible. You cannot see hearing loss just by looking at a person or looking at your child's ears. However, if they are missing the outer part of their ear or something, then obviously that is noticeable. And this is a very interesting tidbit. 3 out of 4 children will experience at least one ear infection. It's also known as otitis media by the time they are 3 years old. So a lot of children often have ear infections when they're getting older, some a lot more than others. And every year in the United States, there are approximately 12,000 babies born with hearing loss. And according to the American Journal of Audiology, hearing loss is actually the most common birth defect. So, which is why it's fantastic. We're able to screen about 98% of our newborns for hearing loss. So what are some causes of hearing loss? You can kind of take hearing loss and separate it into 2 different categories. You have your genetic category, where if it tends to be a dominant trait or a recessive, but both parents tend to have that recessive trait, then a lot of the cases with genetics are attributed to that. So that's about 50 to 60% of the hearing loss cases. The other half are the non-genetic cases. And you can further divide that into kind of we just don't know. That ends up being about 25% of those cases. And that other 25% tends to be maternal infections, so things like CMV is a popular one. If there was head trauma at all, either shortly after birth or when they're a toddler, if they hit their head and something happens and it happens to affect the hearing, or if there's complications after birth, if the baby had problems with oxygen and breathing and things like that, if they had really severe jaundice is another example, requiring any blood transfusion, things like that. So there can be several non-genetic causes for hearing loss as well. Some other possible causes for hearing loss, this is probably as you're looking to when the children are getting a little bit older. Noise is a very big cause. Ever since the Industrial Revolution, excessive noise is the #1 reason for hearing loss. Music, toys, hunting, using power tools, doing construction work, being near fireworks, all of those can potentially have levels that are loud enough to create some hearing loss. From the American Academy of Pediatrics, about 15 in 1,000 young people under the age of 18 have some degree of hearing loss. And about 1/3 of those cases can be attributed to excessive noise in the environment. So a lot of kids, a lot of teenagers listening with their iPods and having those earbuds in their ears. Unfortunately, there's been a lot more cases of hearing loss found because of that. Some other causes are disease processes like diabetes, or if a child has a stroke or some sort of vascular accident like that, that can potentially cause more hearing loss. Certain medications can, if a child has cancer, being on any treatment like chemotherapy or radiation or any kind of medications they're using to treat that, we definitely monitor those children a lot because they've shown to have potential serious effects on their hearing. Excessive use of aspirin or ibuprofen has also been researched and shown to have some possible effects on hearing and developing hearing loss. Okay, so the different types of hearing loss, there are 3 different types, or 3 main types and then another subtype. This first one is called a sensorineural hearing loss. This is the most common type of hearing loss. Approximately 95% of all cases are sensorineural. And what that is a reduction in the ability to hear due to the disorders in the inner ear or the cochlea or the hearing nerve. So some part in that inner ear, that blue spiral part, is not working correctly. And so that's where the hearing loss is at. This type of hearing loss is permanent, so this cannot be fixed with surgery or taking a special magic pill and restoring that. So once that damage is there, it's there and nothing can recover it back to normal. This type of hearing loss tends to be very slow or gradual over several years. Not always the case though, so anytime we identify children with hearing loss, we want to make sure we're monitoring them and that their hearing's not changing rapidly, or if it is, that we're able to manage that. Okay, the second type of hearing loss is called a conductive hearing loss. This type of hearing loss can sometimes be corrected with surgery. This type of hearing loss is the reduction in the ability to hear softer sounds even though the inner ear is working normally. And usually this is because the eardrum or those 3 small bones, something's going on with that part of the ear that it's not able to get that sound down to the inner ear correctly or to be loud enough for it. So some examples of what can cause that are ear infections, having significant wax buildup in the ear canal, having a hole in your eardrum. Those are pretty common ones that can definitely make it more difficult to hear. In this type of case, having a conductive hearing loss, you should definitely be seen by an ear, nose, and throat physician to determine if surgery or some medical intervention can be done. The third type of hearing loss is called a mixed hearing loss, and that is just what it's implying. It's a combination of a sensory neural component and a conductive component. So an example of that would be if you had some permanent hearing loss, but then also had an ear infection on top of that. So the ear infection is temporary and it's making it difficult for the sound to get down to the inner ear, but then once it's getting down to the inner ear, sound is also not being loud enough for that person. With a mixed hearing loss, once that child or once that person is medically cleared, ruling out if surgery can be done or if medications can be used to clear up an infection, for example, then that person can successfully use hearing aids. So if a child was diagnosed with hearing loss and then they developed an ear infection as they got older, after using medications or whatever we needed to do to clear that up, then they can successfully use those hearing aids. Another type of hearing loss that's not really well known is called auditory neuropathy or dyssynchrony spectrum disorder. This is where sound enters the ear normally, so each part is working up to that inner ear, but because of the damage to the nerve, sound isn't organized in a way that the brain can hear or understand it properly. So the signal is just not getting transmitted properly, is another way to look at it. They don't really know what causes auditory neuropathy, but they have identified several risk factors. Some of these include hyperbilirubinemia, which is jaundice, having a premature infant, low birth weight, lack of oxygen. Some genetic factors have been known to cause it, and if there's certain neurological disorders like epilepsy or things like that. Some of the characteristics of auditory neuropathy, really there can be any degree of hearing loss. So it can be normal hearing or it can be all the way down to a profound hearing loss. What we will notice in people with auditory neuropathy is that their ability to understand speech is very poor, especially in noise. Both ears usually tend to be affected, and this is known to kind of fluctuate, meaning maybe at one point their hearing is really good, very normal, and then maybe the next month or something when they're tested, they're showing a severe hearing loss. So it can tend to fluctuate quite often. Okay, so now what we're going to go over is the degree of hearing loss. The degree of hearing loss describes how much hearing loss is present, and this is measured in decibels. A lot of people will say, I have a 50% hearing loss, and that's really hard to do that because two people can have this, or two children can have the same type of hearing loss, but perform much different depending on what kind of intervention they've had and other different factors, what caused the hearing loss, etc. So this is a graph of how we define the different degrees of hearing loss. So normal is a range from -10 to 15 decibels, and then we go from slight, which is 16 to 25, and then we have a mild hearing loss, a moderate hearing loss, moderately severe, severe, and then profound is similar to what most people refer to as deaf. So as we go further down from slight to mild all the way down to profound, hearing loss is much more severe or much greater. And we'll look at some other examples later on of what those types of hearing loss look like. So this is a website that we're going to pull up. They have some different examples of simulating hearing loss. There's a lot of different clips that will attempt to do this, but it's really difficult to truly simulate what hearing loss is like because everybody is a little bit different. But we'll pull this up and take a look at a couple of different examples. So what they have are different examples for normal hearing and then having mild hearing loss and then moderate hearing loss. So what we'll do is we'll play the normal one first.
Out west, a high pressure system is in control with some heavy rains coming into the Pacific Northwest. Now, this same system is bringing snow to the Cascade Range, and there are very, very cool temperatures, only in the low 30s right now.
And we'll listen to it with a mild hearing loss.
Out west, a high pressure system is in control with some heavy rains coming into the Pacific Northwest. Now, this same system is bringing snow to the Cascade Range, and there are very, very cool temperatures, only in the low 30s right now.
So you can still understand it pretty well, but there's a few, it doesn't sound quite as clear. And here's with the moderate hearing loss.
Out west, a high pressure system is in control with some heavy rains coming into the Pacific Northwest. Now, this same system is bringing snow to the Cascade Range, and there are very, very cool temperatures, only in the low 30s right now.
So as you can tell, you can hear that there's some speech, but it's very difficult to understand exactly what's being said. We can go down to a couple of different examples here. Some environmental noises. Let's see. Do birds. And now with the moderate hearing loss. Here's with a mild hearing loss. You can't hear it with a moderate hearing loss. So we'll do that again. Here's normal. Here's a mild hearing loss. And then the moderate. You can't hear. We'll do one more example here. We'll go to music. Everybody knows Beethoven, so we'll play a Beethoven clip. This is with normal hearing. With mild hearing loss. And with moderate hearing loss. So you can still hear it, but it's definitely a lot more, doesn't sound quite as nice as it does with normal hearing. So the next thing we're going to go over is the configurations of hearing loss, or the different shapes that a hearing loss can have. And here we have 5 different shapes. What we'll take a look at some examples later on. We can have a flat hearing loss, where hearing loss in both low, middle, and high pitches is the same across the audiogram. A sloping hearing loss, where there's better hearing in lower pitches but poorer hearing in higher pitches. A rising hearing loss is the opposite of the sloping, where there's more hearing loss in the low pitches and better hearing loss in the higher pitches. A cookie bite hearing loss is if you imagine somebody biting into a cookie. There's more hearing in the low pitches and the high pitches, but there's more hearing loss in the middle pitches. So it kind of has that U shape to it. And again, we'll look at some examples. And then a noise notch. What a noise notch hearing loss is oftentimes we'll see normal hearing, and then at a very specific range of higher pitches, the hearing will drop down to a hearing loss, and it can be any degree, but then recover in the very highest pitches we test. So it looks like a check mark almost. And again, we'll take a look at those later. So, a lot of people wonder, well, how can hearing loss affect my child? I mean, if I just speak up a little bit louder, they can hear me fine. So What they may or may not know is that critical age for development in children occurs from 0 to 3 years of age. This is really where the brain begins to develop tens of billions of different connections on learning language, learning what sound is, what they're looking at, fine motor skills. Their development just skyrockets from when they're born up until 3 years of age. If you think of everything that children experience and learn in that time period, their brain is processing a lot of information during that time. If there's hearing loss that is not identified or identified but not treated, then there's definitely a lot of delays that can occur. Delay in being able to develop their language, delay in speaking or knowing how to say their words, delays in how they learn just concepts in general. So there's a lot of things that can happen when the hearing loss is not identified. These are just a few different ways that the development can be impacted. It causes a delay in what we just mentioned in the receptive and expressive communication skills. So understanding what's being said and also being able to speak as far as saying their words and their sentences and communicating what their wants and needs are. The language deficit can cause learning problems that result in reduced academic achievement. So when they get to school, having that delay in language can make it more difficult for them to understand basic math concepts or abstract ideas or certain science concept, and can really, impact how well they do in their class. A lot of times children with hearing loss, if not given the proper management, will fall behind in their grades because of that. Communication difficulties from a social standpoint can lead to social isolation and poor self-concept. Their self-esteem is definitely impacted if they're not able to hear their friends or talk with others and answer questions correctly. It becomes very embarrassing if that is not answered correctly. And it may impact what they choose to do for their career. If you're choosing a profession that's really important, if you wanted to be a secretary or somebody that works with people a lot, if they can't hear, it's going to be very difficult to do that job. Children who have hearing loss are going to find it a lot more difficult. Again, kind of what we talked about, developing their vocabulary. They tend to have smaller vocabularies if that hearing loss is not treated, mostly because they're not hearing those words. And so by not treating that, their vocabulary can be reduced. Their grammar is affected in that they don't learn or understand how to put those different words together, different tenses, past or future, things like that, what order to use their words in, and something called idiomatic expressions. And those are things where we say, break a leg, but we know that that means good luck. A lot of times those concepts can be really hard for children to understand. A lot of times what they learn is by overhearing or listening, what is called incidental learning. And so if they hear break a leg, they might take that in the literal sense. What do you mean break a leg? And not understanding that that means good luck. A couple of other examples are raining cats and dogs means raining very hard outside, and in a nutshell means a very brief summary of something, not literally in a nutshell. And then there's other aspects of verbal communication that can really impact how a child learns how to communicate with others. Few others listed here as potential negative aspects are social awkwardness, academics are poor, they're more likely to repeat a grade, and again, this is if their hearing loss is not treated or not identified and managed appropriately. Not being able to participate in whispered conversations, being left out on the bus or on the playground. They may seem like they are daydreaming or not listening and may be more likely to be in trouble. If they can't hear the teacher talking in the classroom, then it's not really interesting to them, and then they start doodling or start calling out to their friends, etc. For the younger children, how hearing loss can affect them, it can make it very difficult for them to hear mommy and daddy's voice. If mommy is calling their name and they can't hear it because she's in the other room, that makes it very difficult for them to communicate to their child. Depending on the degree of hearing loss, some children will startle to loud sounds. So some parents say, well, the dog barks and they jump to that, so I don't have any concerns that they have hearing loss. But if it's a big dog and the dog has a big loud bark, that's going to be easy to hear compared to a very soft, if there is such thing as a soft dog bark. They may have difficulty with localization, so being able to tell where sound is coming from, especially if they have normal hearing in one ear and a hearing loss in the other ear, can make it very difficult. Learning their name can be somewhat tricky, especially if they have certain sounds in their name that have softer parts to it, like Sarah or Chris with those higher pitched sounds. And they may not know where their family is if they're not within their visual range. So if they can't see mom or can't see dad, and they don't know what's going on and they can't hear if they call off to that side, that can be really scary for a child. This was an interesting fact I found in an article, that when somebody with hearing loss grows up, it can potentially affect their income as they begin working if they choose to not treat the hearing loss, and they may earn anywhere from $5,000 to $13,000 less a year compared to those who don't have the hearing loss. This also means that they may have less discretionary income or kind of extra money around, and that's usually thought to be because they have less earning power to begin with. So how does hearing affect learning? If there's untreated hearing loss, as we talked about, there's going to be delays in speech and language development, and that can really make it difficult for the child to learn later on, whether it's English, math, science, history, whatever the subject may be. So this is kind of what the connection is. With normal hearing, we hear the sounds, and we listen to those sounds and we learn what those sounds are and we label them. Ah is the A sound, or the S sound is S. And once we learn that, we imitate them and we learn to use those sounds. And then as we continue to get older, we know to connect the D to the letter D and things like that. And so we associate those sounds with the letters. And then we know how to put those letters together to form words, and then words to sentences, and sentences to stories. And so when we want to learn something, we read about it or we're taught about that. And so that whole process happens, and then when we want to learn more, we read to learn more. And so if you're not hearing those sounds correctly, or you don't know what those sounds are, you don't know how to put them into the words, you don't know how to label them, and you can kind of see where that connection makes it very difficult for a child to learn different concepts, especially if they're not concrete subjects. If you're trying to teach geometry and 3D objects, that can be somewhat difficult for a child who doesn't have that basic understanding. So, who would test a child? And that would be a pediatric audiologist. And a pediatric audiologist is an audiologist who has the training and the experience to test and give services to infants and young children, and will offer the best care for the baby. And so what a pediatric audiologist will do is test and identify hearing loss in children of any age. They will put amplification if that's the appropriate management they want to do. They will connect families to early intervention services and different parent groups. There's been a lot of research that shows hearing aids or other amplification devices are not the solve all problems. There needs to be early intervention in addition to that. We need to help teach the children how to listen, what they're listening to, and to help them with that learning. And then also directing parents to different community resources. parents definitely do very well with depending on other parents because they know they've gone through that experience and more personal stories can be shared. So what are the different hearing tests that are used for children? Depending on the age of the child, we may use different tests to get the information we need. These are some of the tests, and they include, OAEs, ABR, VRA, CPA, tympanometry, and acoustic reflexes, and we'll just briefly go through each one of these. Otoacoustic emissions is what OAEs are. This test is actually testing the hair cells of the inner ear in response to incoming sounds. So as you can see with this little guy here, there is a little earplug that's put into the ear canal, and these movements are recorded because the inner ear makes these little echoes. It's what they're also known as. These OAEs will be present in ears that have normal hearing and will be absent or may not be completely normal in ears that have hearing loss or other issues like the auditory neuropathy, for example. OAEs can provide very specific frequency information regarding how well the inner ear is working at different pitches. And the nice part about this test is it can be tested on all ages. So from the 2-week-old infant all the way up to 3 years old, 6 years old, and even adult ages, we use this test. The ABR is also known as the auditory brainstem response. This test is measuring the neural synchrony of the auditory nerve. So basically the nerve's response to sound and how it's firing and how it's responding to different volumes or different levels of sound. This actually tests the cochlea for the inner ear, the auditory nerve, and the lower brainstem. So if an infant refers on their newborn hearing screening, this is the test that we often do because it will test through most parts of the ear all the way up to the lower brainstem, and so we can see how each part is working and responding to sound. The nice part about this is that the child, the newborn, does not need to respond. We don't need them to say, I heard that or not. And so this has made a huge difference in being able to identify children with hearing loss at a much, much younger age. So we typically do this on newborns up to about 6 months of age, but we also use this test to confirm hearing loss on children up to 3 years of age, and for those who we may not be able to get reliable responses through other ways of testing, like behavioral testing, for example. VRA is also known as visually reinforced audiometry. This is usually tested on children from about 6 months up to about 2.5 years of age. And what this test is the child tells us what they hear by responding to a sound. So this is usually by a head turn. They heard something and they're looking to see what that sound was, where it came from. And when they do that, we reward them or tell them, good job, you heard that, by flashing images on a screen like a cartoon clip, or here you can see we have Winnie the Pooh and Tigger light up with flashing lights, or sometimes some places will have even toys that move like monkeys with the cymbals clinking and things like that. When they see this, they go, oh, when I hear something and I pay attention to it, I look and I get to see something fun, something interesting. And so with this test, a lot of times parents can really help with this test by teaching their child sound awareness. So children are born knowing how to listen. They can hear, or with hearing loss, they need to be taught that when they hear sound, they need to pay attention to that, and that is not just noise. That sound does have meaning. So if the phone rings, it's saying, oh, did you hear that? The phone is ringing. Mommy's going to go answer the phone. And that really points out to the child that sound has meaning. It does mean something, and it's not something to ignore. So this test can be done on pretty young age. They're able to tell us what they can hear between these ages. CPA is known as conditioned play audiometry. At this age, we can do about 2.5 years old up to about 5 years of age. And what the child does is they are taught to complete a task when they hear sound. So this task may be holding a block or a ball up to their cheek and then dropping it into a bucket when they hear sound. Other things might be giving a high five or building a tower or completing a puzzle, something where they do a task after they hear a sound. This tends to be a lot more of a fun game. It's more interactive, and at this age, very important to get so we can get all the information we need from them. So tympanometry and acoustic reflexes. This is a test that is done to look at the function of the middle ear and the middle ear muscle reflex we have. So this is a test that can help us know if there's fluid built up behind the eardrum or if there's negative pressure built up when you go up in an airplane or come down from higher elevation and your ears pop. That's kind of what we're looking at there. Also, if there's a hole in the eardrum, this test can let us know if there is one, because sometimes the holes are very, very small that you can't see them. The acoustic reflexes test the function of the 7th and 8th cranial nerves. So when our ears are exposed to very loud sounds, our body tries to help protect its hearing by contracting, just like a reflex would if you touched a hot pan or something, for example. And so when exposed to a loud noise, that muscle contracts and makes it more difficult for that sound to get down to the inner ear. So the reason we test that is to make sure that those nerve pathways are doing what they're supposed to. The nice part about this test is that it only takes a few seconds to run. So when you have a 2-year-old that doesn't want to sit still, if we can get them to sit still for about 5 seconds, we can tell how well their middle ear is functioning. And most importantly, this test is not painful at all. However, as I mentioned here, if there is an infection, things don't feel comfortable and it's inflamed and they may be in pain, so then that test could be uncomfortable. All right, so what we're going to go over now is what is an audiogram. An audiogram is how we draw a picture of somebody's hearing. So this is a graphic representation of the softest sounds or the hearing thresholds that a person can hear. So as you can see on this picture, the red circles are your right ear and the blue X's are the left ear. Where these X's and O's are in that gray shaded area is normal hearing. So this is showing for this particular person the softest sound that can be heard at a bunch of different pitches. So here, this is low pitch to high pitch. The numbers at the top where you see the 125, 250, 500, 1,000 all the way over to 8,000, those are the most common pitches that are tested for the hearing. And so the smaller the number, the lower the pitch or more bass type tones. As you work your way to the right, they become higher in pitch or more like the treble sounds. And then here on the left side where it goes from -10 to 0, 10, 20, all the way down to 120, that is going from soft to loud. So that's the volume of these sounds. And so the bigger the number, the louder the sound gets. Okay, so this is kind of a nice picture that just shows, looking from left to right on the top of the audiogram is low pitch to high pitch, and then on the left hand side you start with very, very soft sounds, and as you work your way down they become very, very loud sounds. And then they also have the different degrees of hearing loss that we talked about earlier, from normal hearing down to mild, moderate, moderately severe, severe, and profound. So this is a very popular picture. It's called the audiogram of everyday sounds, and on here they've put all these different sounds of what pitch they tend to be and the loudness that that sound tends to be. So for example, when we listen to the birds with that audio clip, the birds are very high-pitched sounds. You can see them in the upper right-hand corner. So they're to the right of the audiogram and at the very top. So that means it's a very soft, high-pitched sound. If you have hearing loss in the high pitches, as you heard with that moderate hearing loss, it's either very difficult to hear those birds or you don't hear them at all. With the dog, you can see on the lower left-hand corner, that tends to be a lower pitch sound. And it's also a lot further down on the audiogram. So it means it's a louder, lower pitched sound. The other thing I want to point out are all the letters. Those are actually representing the sound that those letters make. So as you can see, they're kind of spread out all the way across from left to right. So some sounds, depending on the degree and the shape of the hearing loss, some sounds children may be able to hear just fine. Other sounds they may not be able to hear well or not hear well at all. And we'll look at a couple of examples. Any questions about this picture at all? No? Okay. If you do have any questions, just let me know. So here are the different shapes of the hearing loss. So the first one is the sloping, where we mentioned that hearing in those lower pitches or more bass tones is better. And then as we work our way to the right into those higher pitches, it slopes. So it slopes into poor hearing or more hearing loss. To the right of that, you have a flat hearing loss. This means that the hearing loss is the same in the lower pitches and the higher pitches. It's about flat, I guess, just straight across. The one on the bottom is the cookie bite, where they have better hearing in the lower pitches and the higher pitches, but in those pitches in between or mid frequencies, there's more hearing loss. And then here's the rising, or it's also known as a reverse slope hearing loss, where there's more hearing loss in those lower bass pitches. And as we work our way to the right to the higher pitches, their hearing is better. And then here is an example of the noise notch hearing loss, where their low pitch hearing is in this case is very normal, and then it slopes down in those higher pitches and then kind of tends to come back up. So you kind of have, it looks like a backwards check mark almost. And oftentimes with this kind of hearing loss, that noise exposure has created a specific area of hearing loss that's poorer than other pitches. Okay, so I think we're towards some of the last few examples we have here. This is an example of a mild hearing loss. So with a mild hearing loss, there's going to be difficulty with being able to hear faint or soft speech. Also, even with a mild hearing loss, a child in a classroom, if they are sitting towards the back of the room, it's going to be that much more difficult to hear the teacher, especially if there's other noise going on in the classrooms and things like that. A moderate or moderately severe hearing loss, they're often going to have difficulty hearing speech that is spoken at kind of a normal conversational level. They will not be able to hear faint speech, so whispered conversations, things like that, especially when there's noise involved, it's going to be much more difficult to understand what's being said. This is an example of a severe hearing loss, and I should have probably pointed out, you can see this gray shaded area here. This is kind of representing that speech banana. This is where all those speech sounds that we saw on that other example are at. And so the circles and the X's are below that. And that means that they cannot hear this at all. So remember back to some of those other examples, normal hearing is when the X's and O's are up here. So with the severe hearing loss, they can only hear shouted or amplified speech. So if the severe hearing loss was not treated, they probably would only be able to hear loud environmental sounds like a siren or horn honking or something like that. And then here is a profound hearing loss. A profound hearing loss is when you cannot hear amplified speech. Can be very, very difficult to understand what's being said. even when things are amplified very loud. There's been a lot of damage to the inner ears or other parts of the ear, making it very difficult for sound or speech to get to the nerve. These are several different websites that have a lot of really good information about hearing loss, children, different effects that hearing loss can have. The 0 to 3 website has a lot of information on different activities to do with your children, ideas on how to develop language. The one on the bottom is a very helpful website as well. I believe was started up by, I don't know if it was started up by a parent or not, but lots of information on that site, as well as the Hands and Voices website. It's a fantastic website. And that's all of us at the Elks Hearing and Balance Center. So we went over a lot of information. It's kind of hard to condense everything into a small presentation on what hearing loss is and how to manage it and look at it and what it means and everything. So does anybody have any questions? So the question was, what is the incidence of hearing loss in pediatric population? And the incidence of hearing loss is about 3 to 6 children every 1,000 births. So it's the most common birth defect is what they call it, and it happens.
Specifically interested in ear infections.
Another question was the incidence to repeated ear infections. And I don't know if I have an exact number on that. Every child is a little bit different depending on how chronic those ear infections are and how severe they are. So how long that infection's been sitting in there before it's been managed. Some children have infections and the parents are just not even aware of it because they show no signs of pain or discomfort at all. I don't know the exact number for that. If left untreated, it can have an effect on how that sound is transmitted. So you may be likely to see a conductive hearing loss where that sound just can't get down to the inner ear as easily. But usually when it's medically treated and watched, it doesn't tend to have severe hearing loss as a result. It may have some mild or moderate hearing loss consequences, but it's a good question. I'll have to look into that further.
My daughter is there.
So one of the questions was, how do we know if our child has a hearing loss? A lot of children will not display any signs. They won't know that they have any fluid built up or any infection, but some signs that you may see may be them tugging on their ears or being a little more irritable than usual. If they've been sick, if they're teething, or if they have allergies sometimes or sinus issues, that can also create some fluid or infections built up. And even if the fluid is not infected, it can still show up as a mild hearing loss. So it can essentially sound like you're listening underwater. So sounds aren't very clear, and it can be difficult to hear, especially at distances and things like that. So if your child's been sick or they're starting to get new teeth in or they have any allergy issues, and you're noticing that maybe they're not responding as well, like you have to say their name an extra time or two, then you may want to bring them into your physician and have them take a look. So the question was, is it common for a newborn to pass their newborn hearing screening and then fail any further testing, correct? There are some cases where if the hearing loss is genetic and it's a progressive hearing loss, they may initially pass at their newborn hearing screening, and then as they get older and hearing loss starts to develop, then yeah, they may not pass, like a preschool screening, for example, or you might start noticing more signs like they're not seeming to hear sounds as well as they used to, or not responding to their name, things like that. Yeah. hmm Does that answer
Yeah,
your question?
my little guy supposedly passes newborn screening, but by 8 months has failed 3 tests in a row. So I'm assuming that he probably may not have really passed his newborn
Okay.
screening. I mean, is that pretty common to,
No, not really.
even if it was genetic, like I can't imagine that from 3
Right.
weeks old to 7
Yeah.
months old. It's
Mhm. And in some cases, one exception might be if they had meningitis, for example. That could be a case where that's very instantaneous and sudden. But typically, if they pass their newborn hearing screening and then subsequently fail 3 or refer on 3 other tests 8 months later, I might question how that screening was conducted. Sometimes there can be equipment or operator error, or maybe something made the test think that it was a normal response from the ear. There's several different factors.
And typically, like, can fluid, like I know that the fluid's there in the middle ear, can that affect or show like a hearing loss that's further in? Like, is there any way that that fluid, whether, I mean, there's no chance of ear infection, they haven't had an ear infection, there's not a current infection going on, and can that fluid, I guess, kind of have a false positive reading on any of the tests?
So the question was, if there's fluid in the middle ear, can that give a false positive
Yeah, like a
On-
ear infection kind of fluid, would that give a false positive on any sort of?
on any other test? That's a good question. With that tympanometry test that we do, that will let us know if there is fluid behind the eardrum or not. It doesn't tell us if it's infected, but it just says there's something going on behind the eardrum that it cannot move normally like it should. So then when we put them in the booth to do any of that behavioral testing like we talked about, and we see some hearing loss, we have those 2 pieces of information that say there's hearing loss, but there's fluid going on, so that's probably contributing or is the cause for that hearing loss. So we don't ever really get a false positive necessarily. It's if it's showing that the eardrum's not moving, then we know there's something going on that shouldn't be going on, and then we do further tests to see what that is. And in young children, oftentimes it does tend to be fluid. Not always, but often. Does that answer your question?
And then, I mean, I guess even if it was fluid, would the test still show the same every single time? Like, my little guys had tests 3 to 4 weeks apart from each other, and they're still showing the same
They're still showing.
loss, so I'm assuming
Okay.
it's not the fluid, it's not it's natural hearing loss.
So with that test, if it's showing the same thing, it could be that fluid has not yet gone away. And so when they're testing it, they're getting those same results, whether it's him responding always at either the mild hearing loss, or if it's always showing his eardrums not moving, it's either maybe that fluid has not gone away, or maybe it went away, but then now some new fluid is starting to build up again. So it can be really hard, even when it's only 3-4 weeks apart, because every child is different. Some of them resolve that fluid very quickly, and others it just does not go away no matter what. And then usually at that point, if medications aren't working, or if they don't want them to become resistant to antibiotics, they'll do what's called tubes, put tubes in the ears to help so that fluid can drain out. So does that answer
Yeah, I mean,
more?
I'm assuming that just because of history from either my hearing loss or when my little guy was born, all this stuff happened, like, I'm pretty sure it was not fluid. I'm just
Okay.
trying to rule everything
Right.
out. you know what I
Right.
mean?
Oh,
Especially if I think
absolutely.
about it, that's really what.
Yeah. Mm-hmm.
Yeah, I think that's, the scarier thing is that the fact that there's fluid in the middle ear, some might say, oh, well, there's a hearing loss because of the fluid in the middle ear, and not go any further and look at the inner ear and test some of these other components, and then you miss it and time goes by, you know, and you're blaming it all on this fluid, when yeah, that fluid might be contributing, but there might be something more is off, right?
Mhm.
I think
Where
that's,
you could have that potential mixed hearing loss where
Yeah.
there could be permanent hearing loss, but that fluid or that conductive component is masking that. So, and they're focusing on just that instead of testing the whole system. These are great questions. Any other?
How long has that, the OAE test been done for? How long has that been?
How long has the OAE test been around? They first started doing that. It was first noticed in the early 1980s, but it didn't become common clinical practice until probably the early 90s, mid 90s. And then at that point, they realized how valuable it was for screening newborns for hearing loss, because a lot of times with the OAEs, if those responses are not there, that can suggest that there's some hearing loss present and kind of trigger to have that baby or that infant tested further on. So it's been around for a while in research and things like that. Probably in the last 15-20 years is when it's been really used for clinical purposes for the infants and things.
That's what, my daughter is like